So we just want to differentiate between two types of pregnancies this morning. Now, this is not biochemistry, right? It's biochemical. Sorry, I left it purposely to come and correct it, okay? Because some people used to call it biochemistry pregnancy. It's biochemical pregnancy, okay? So let me just give you an overview. When a woman comes to you, she's complaining that, doctor, I've missed my period and all those stuff. So you might now want to come and do some one or two tests. So you do some tests and you see that estrogen levels are shooting up, progesterone levels are shooting up. Now, this alone doesn't make you confirm pregnancy. Do you understand? The more that's like a biochemical, you saw pregnancy, but this was based on hormonal changes. So clinical pregnancy is more of like, I'm doing an ultrasound, I'm trying to ensure that there's a fetus and it has implanted. Do you understand? So it's just two types of pregnancy. The biochemical pregnancy is not confirming pregnancy because several other things could make those hormone levels to rise up. Okay, so let's talk about it. First of all, biochemical pregnancy, you are just trying to pick up progesterone levels rising, human chorionic gonadotropin rising, human placental lactogen rising, inhibin levels, okay, and all. Simple. Okay, then metabolic adaptation, like there's increased plasma volume, increased lipids, transport proteins, decreased albumin, decreased urea creatinine, insulin resistance. Yes, all these things happen in pregnancy, but quite alright, I was saying other disease conditions in the body can also make these things happen. So if you pick it up on a test, does that confirm? No. You have to rule out by confirming with ultrasound. Okay? Then for the clinical pregnancy, it's just been confirmed by clinical evidence, not just biochemical markers. You understand? So criteria for diagnosis is yes, you still use biochemical markers, but you are still doing clinical confirmation. So human chorionic gonadotropin levels, first of all, must be raising up. Ultrasound visualization of gestational sac, yolk sac, fetal pole, heartbeats. Okay, so clinical and chemical pregnancy, right? So is the chemical pregnancy is only by human chorionic gonadotropin, then also progesterones and estrogens. But clinical one, you are confirming that an embryo is implanting. Now we'll get to talk about several other things that might cause those hormones to rise up, just like in pregnancy. That sometimes you might just miss them out and reassure a woman wrongly that she's pregnant. Meanwhile, it is these other conditions that she has. You understand?